we're going to look at the classification of the antiplatelet drugs. So to begin with some questions, the Varaparex, so Pexer, so this comes under what classification? And then we want you to name some examples of the irreversible P2Y12 inhibitors. So in this video, we'll find these answers and learn in detail. So to begin with, firstly, we are going to look at the cyclooxygenase. Cyclooxygenase. Oxygenase 1 inhibitors. So this, it includes the drug aspirin. Then we look at the irreversible P2Y12 inhibitors. So irreversible P2Y12 inhibitors, this includes the ticlopidine. It includes the ticlopidine. Then it also includes the clopidogrel. It includes the clopidogrel as well as the prasugrel. Next, we look at the reversible. So this was the irreversible, then the reversible P2Y12 inhibitors. So this reversible P2Y12 inhibitors, it includes, there is the ticagrelor as well as the cangrelor. Next, we move on to the GP2B and the 3A. GP2B and the 3A inhibitors. So what is special about this? So this drugs, it includes the eviximab, then the FT fibatide, and also the tirofiban. Next, we look at the thrombin receptor antagonist. So the thrombin, that is a PAR1. The PAR1 receptor antagonist. So this drugs, it includes the Varapaxar. So it includes the Varapaxar. Then we also look at the phosphodiesterase inhibitors. The phosphodiesterase inhibitors, this includes the dipyridamole. Now we are going to answer our questions. So the first question we asked was, in case of the Varapaxar. So what classification of drug does this come under? So Varapaxar, it comes under the thrombin. It comes under the thrombin PAR1 receptor antagonist. It comes under this antagonist. Next, when we look at the examples of, the next question was in case of the irreversible P2Y12 inhibitors. So what is the, in case of the irreversible P2Y12 inhibitors, what is the drugs? So the drugs includes the ticlopidine. Then is also includes the clopidogrel. All these are irreversible. Clopidogrel and the prasugrel. So in case you want to learn daily, please do subscribe.